My name is Taryn McGilvery. I'm a family medicine physician here at the Northwest Physicians Group Clinic in Canyon. I'm from a very small town. I'm from a town called Lamesa, about an hour south of Lubbock. I had a role model there that was a physician that I met early in childhood, and he knew everybody. He took care of my mom, took care of my grandma, gave me stitches when I busted my head open, and I guess I kind of latched onto that early on and wanted to be like him. I tell patients all the time I like to focus on something called shared decision making, which means I don't just tell you what to do, and I don't treat medicine like a paternal decision. I think it should be kind of us making a decision together, doing it as a team. If you're willing to work with me as a team, obviously I don't always have great things to say, and not everyone likes to hear what I have to say. So I like to come up with a plan together and us to kind of to meet in the middle. I like to tell some of my patients, the reason you need to see me is because I want to make sure we know things are going on ahead of time and just give them a name and know how to treat them before they become a major problem. Things like breast cancer or colon spots, or even just knowing, if your kidneys aren't functioning 100%. Because the worst scenario is to find that out after an emergency room visit and know that you've had a chronic disease for 10 to 20 years. So I like to hit things on the nose and talk about them ahead of time. And like I said, it's not always things everybody wants to hear. We sometimes label your conditions, but we don't give them to you, but we give them a name. So I think that part's important, and it's important to know what you need to focus on specifically just to help give you a longer life and usually more time with your kids and grandkids. I love what I do because I get to meet new people every day. I get to see new problems every day. When you go from one room to the next, you never know what that next room is going to hold. And I think some of the most important decisions people make with their health and as far as their life will usually be with their primary care doctors. So I think it's really important work, and it's an act of heart and an act of love. So.